Good afternoon. The committee hearing on local government and municipal finance will come to order. Madam Clerk, would you please take the roll?
Chair Fitzgerald.
Here.
Representatives Burns. Here. Shannon.
Present.
Breen.
Present.
Rogers.
Here.
Hill.
Here.
Hoskins.
Here.
Pies.
Present.
Zorn.
Here.
Paquette.
Here.
Bazat.
Here.
Bagol.
Here.
Preston.
Here.
Mr. Chair, you have 13 members present. You do have a quorum.
Thank you very much, Madam Clerk. I need a motion from a member to approve the minutes. Rep. Pies makes that motion. Seeing no objection, the meeting minutes from the previous meeting on June 22nd are approved as submitted. Thank you very much for everyone's patience here this morning as we got rolling. We had some committee jockeying to worry about. We are going to be taking up Senate Bill 705 and House Bill 5542 first today. This is something that would actually require the county treasurer to fulfill a request for specific documentation in the treasurer's possession for a requested tax year instead of the current tax year. Allow for a certain request, a request of certain electronic records from a county treasurer if the treasurer possessed those records. Require a county treasurer to consider a request for a winter tax bill and a summer tax bill as a single request when charging a fee for that request. We are also planning on voting these bills out today. We are not joined by Senator Voino. However, we do have Bill Drake from his office here to provide testimony. I'd like to welcome Mr. Drake forward. Mr. Drake, you can begin when you are ready. We do have a number of cards to read in on this one. No, sorry. We do have some cards to read in, but thank you very much for being here today to provide some testimony, and you can begin when you're ready.
Thank you very much, Mr. Chairman. I have Beth Wellness from Zillow here with me. We appreciate the opportunity. The chair gave an excellent description of the bill. The legislation that was passed in 2022, House Bill 4730, had the language for the current year. So sometimes that information is not available. So this tightens it up, and it's for the requested tax year. We worked with the county treasurers. I know they're supportive of the bill. We've worked with many other stakeholders to make sure that everyone was comfortable moving this forward. Representative Steckloff bill is the introduced version of the Senator Voino bill also, and we appreciate your consideration and your time. Thank you.
And I so apologize. Is there anything that you would like to add? Would you mind introducing yourself to the committee?
Yes, thank you so much, Chair. My name is Beth Wanless, and I'm representing Zillow today.
Okay, thank you. Is there anything that you would like to add at this point before we take any questions from the committee?
I'm happy to testify in support if you'd like, or I can just wait for questions, whatever you'd prefer.
Seeing no questions at this moment, you're welcome to provide your supportive testimony.
Okay, thank you so much. Chair and members of the committee, my name is Beth Wanless, and I'm the Government Relations and Public Affairs Manager at Zillow, and I came in this morning from Ohio, so please don't hold that against me. I'm here to support Senate Bill 705. The bill would make technical corrections to current law to ensure reasonable access to public records data used to help Michigan consumers. A special thank you to Senator Voino and his office for all of your help getting this bill introduced. Zillow engages directly with state and local government offices in Michigan to acquire public records data relating to real estate, including property tax assessment records. Once acquired, we extract data points from the public records and combine it with other data, which then becomes what you see on Zillow. In a simple, easy-to-use interface, any consumer can pull up nearly any house and be provided at no charge with a detailed historical record of the property tax information, including both the assessed value and the amount of property taxes paid, and the real estate sales history of that property where it's allowed. Zillow also uses this public records data, to provide important economic and housing research to state and local governments, nonprofit partners, and university researchers across the United States, again, at no cost to them. Numerous Michigan government agencies, nonprofit organizations, and university researchers have used this free data source to conduct meaningful research on Michigan-specific economic and housing issues. The substitute version of the Senate bill is the result of conversations and compromise with the Michigan Association of County Treasurers. We have worked with the association and their members and have agreed on changes to the legislation that you have before you. The legislation passed unanimously out of the Senate Local Government Committee this summer with no known opponents and 2 proponents at that time. The changes were very nicely summarized, but I'm happy to answer questions on that. There were just a few changes to the wording to clarify when a request is made. It's for whatever that requested year is, not the past year or the current year. And then, of course, if the winter and summer tax rolls are requested at the same time, that's just clarified as one request. But if Zillow were to send an email request to a county treasurer and say, we want the summer tax roll, please, and then 2 days later say we want the winter tax roll as well, that is two different requests, and you do have to pay two different amounts. I think that pretty much sums up what the bill will do for the most part. We did work with the county treasurers again, and we really appreciate them coming to the table to work with us to clarify a few things. And with that, I'd be more than happy to answer any questions that you may have.
Looking around, I see no questions. I just wanted to confirm, though, obviously we did have an original double set, House Bill 5542, which was a Steckloff bill, excuse me, has remained in the House, but Senate Bill 705 has had a great deal of work on it in the Senate prior to making its way to the House chamber. Am I correct?
Yes, sir.
Okay, thank you. With that, I don't have any questions for you or anyone from the committee, so thank you very much. I do have some cards to read in. Not wishing to speak in support of the bill, Brad Ward from the Michigan Realtors. Not wishing to speak in support of the bill, Alan Fox with the Michigan Association of County Treasurers. With that, I will entertain a motion to report Senate Bill 705 with recommendation. That motion is made by Rep. Shannon. Madam Clerk, would you please take the roll?
On the motion to report, Chair Fitzgerald.
Yes.
Representatives Burns.
Yes.
Shannon.
Yes.
Breen.
Aye.
Rogers.
Yes.
Hill.
Yes.
Hoskins.
Yes.
Pice.
Yes.
Zorn.
Yes.
Paquette.
Yes.
Bazat.
Yes.
Bagol.
Yes.
Preston.
Yes.
Mr. Chair, you have 13 yeas, 0 nays, 0 pass. Senate Bill 705 is reported.
Thank you very much. While we prepare to take up House Bill 5695, we're going to go briefly at ease at the call of the chair. Committee will come back to order. Thank you for everyone's patience. So now we will be taking up House Bill 5695, Rep. McFall's bill, which would require DHHS to apply to the United States Department of Health and Human Services for an amendment to the state's Medicaid state plan to establish and administer a program to provide supplemental reimbursement for eligible ground emergency medical transportation, providers that provide ground emergency medical transportation services to medical assistance recipients, otherwise known as Ground Emergency Medical Transportation, or GEMT program. We have an H2 substitute offered by Representative Shannon that incorporates feedback and suggestions from DHHS, and we're going to have we will have our stakeholders discuss the changes in detail. But for now, we do need a motion to adopt the H2 sub to HB 5695. That motion is made by Representative Hill. Madam Clerk, would you please take the roll?
On the motion to adopt the H2 substitute, Chair Fitzgerald.
Yes.
Representatives Burns.
Yes.
Shannon.
Yes.
Breen.
Aye.
Rogers.
Yes.
Hill.
Yes.
Hoskins.
Yes.
Pies.
Yes.
Zorn.
Yes.
Paquette. Bazat.
Yes.
Bagul.
Yes.
Preston.
Yes.
Mr. Chair, you have 13 yeas, 0 nays, 0 passed. The H2 is adopted.
Thank you very much, Madam Clerk. So we do have Representative McFall here to testify, and alongside Representative McFall, we will have Captain Dwyer from the Madison Heights Fire Department, Chief Kevin Edmonds from the Sterling Heights Fire Department, and Deputy Commissioner Derek Hillman from the Detroit Fire Department. If you all like to make your way forward, you are welcome to join us here. Thank you so much for taking the time to be here to testify on this bill, and you may begin whenever you are all ready.
Thank you very much for taking this up. Thank you for having us today. Chair Fitzgerald, I appreciate you guys taking the time to do this. The United States Center for Medicare and Medicaid Services, CMS, oversees the Ground Emergency Medical Transportation Program, which provides funding and support to eligible healthcare providers through the state agencies to ensure that individuals without reliable transportation can access emergency medical care. This program improves access to emergency services for Medicaid beneficiaries, bridging the gap between patients and healthcare facilities during emergencies. Although Michigan is currently not part of the program, it ranks 8th in Medicaid enrollees nationwide. Local emergency services and ambulance providers struggle to cover the cost of medical transportation for this significant population. The GEMT initiative in Michigan aims to address health disparities, promote health equity, and reimburse local agencies and emergency service providers for serving vulnerable populations. About 2.7 million residents are on Medicaid, and many of their communities could benefit from participation in this program. Revenue sharing is down for local communities, as we all know. GEMT will help fill this gap in city budgets, actually in municipality budgets, because this would also include counties and townships. We are currently sending tax dollars to the federal government and not getting them back. So it's money that we're actually leaving on the table. This will help Michiganders' federal tax dollars come back to be used in Michigan. You have many cards that have probably been submitted, but some of the supportive communities include Sterling Heights, Hazel Park, Ferndale, Madison Heights, which would be about $400,000 a year. Dearborn Heights is about $135,000 a year. Harrison Township, Canton, Charter Township, Southfield, Orion Charter Township, Macomb County, Livonia, Westland, and many, many more across the state, including like in the Upper Peninsula, Marquette could benefit from this. So, I mean, it isn't just in the Metro Detroit. I realize most of those are in the Metro Detroit area, but this is actually something that could be beneficial across the state for many municipalities. I did want to let you know that the substitute language, it comes from MDHHS. The changes better align this bill with the department's process and procedures to ensure smooth implementation of the program. I will let my chiefs over here speak on some of the details of the program and also give you examples of how they could benefit from this.
Thank you. Honorable members of the Michigan Legislature, on behalf of the Michigan Fire Chiefs Association, Macomb County Chiefs Association, and the City of Sterling Heights, I'd like to thank you for the opportunity to discuss ground emergency medical transport with you today. Having served as a Sterling Heights Fire Chief since 2021, I bring with me successful experience of the GMET program from Illinois, where it was implemented in 2019. The program, which provides supplemental federal funding for public agencies, has proven to be a game changer by helping offset uncompensated costs that we incur. Hospitals have used a similar program for the last 20 years to cover uncompensated costs. Emergency medical services in Michigan are currently facing a crisis with challenges such as staffing, increased service delivery costs, and rising call volumes. We currently need help with the economic side of the EMS crisis. The GMET program, which is additional federal dollars for local communities, could provide the support that we need. The reality is a large percentage of our local EMS funding comes through ambulance billing. Fees for the primary sources are federal government, Medicaid, Medicare, private insurance, and self-pay. As society ages, the principal payer has shifted from the private insurance to the federal government. Over 50% of our EMS billing comes from Medicare, Medicaid payments. The GMET program is designed to offset the low reimbursement we receive from Medicaid, which typically only covers 25% of our costs. The GMET program is designed with flexibility in mind. This program is voluntary and requires each agency to complete a cost report. These cost reports are used to calculate the cost of uncompensated care for each agency. The agency will then receive approximately 63% of the uncompensated care costs for Medicaid transports from the federal government, providing much-needed boosts without imposing undue obligations. There is little to no cost to the state. Now, how will this help Michigan EMS providers? Approximately 160 agencies in 49 counties could benefit from this program, which will bring additional federal dollars to help struggling agencies with the increasing cost of EMS services. The potential impact of the GME program is significant. Michigan's EMS providers could receive $50 to $70 million of additional funding, paving the way for improved access to, quality of care, and a path to sustainability. Some communities have already completed preliminary cost reports detailing the cost of providing these EMS transports and potential additional funding that they could receive from this program. We also have 13 communities that have passed local support resolutions for this program, a testament of the hope and optimism this program brings. Sterling Heights would receive approximately about $900,000 in additional funding for its EMS system. This funding would allow Sterling Heights to add personnel resources and establish a mobile integrated health program to help curb our rising EMS calls. Implementing the GMET program in Michigan will support public EMS agencies by providing federal dollars in the amount of $50 to $70 million at little or no cost to the state. Please consider the many benefits of this program and take the action to implement the program in Michigan. Thank you.
Honorable members of the Michigan Legislature, on behalf of the Madison Heights Fire Department and the Oakwood Mutual Aid Association, I'd like to thank you for giving me the opportunity to speak today about the implementation of Ground Emergency Medical Transport Program. The GEMT program is designed to provide supplemental reimbursement to publicly owned or operated emergency medical services providers for uncompensated costs of delivering the essential emergency medical services to Medicaid beneficiaries. This program can be a game changer for Michigan, and I'd like to outline the several compelling reasons why we should move forward in the implementation of this program. 1, financial stability for EMS providers. EMS providers on the front lines of our healthcare system deliver life-saving services to residents at their most vulnerable moments. However, current reimbursement rates for Medicaid transport services fall short of covering actual costs incurred by providers. The financial strain can jeopardize the sustainability of EMS operations, especially in impoverished areas. The GEMT program offers a solution by ensuring EMS providers are adequately compensated, therefore stabilizing their financial footings, enabling them to continue high-quality care. For example, Madison Heights payers mix for 2023 reflected a 26% revenue collection from Medicaid participants. The GEMT program would have provided the Madison Heights Fire Department and the City of Madison Heights an additional $400,000. 2, enhance access for emergency medical services. While EMS faces financial instability, it can lead to reduced service availability, long response times, and diminished quality of care. By implementing the GEMT program, we can help ensure Michiganders, regardless of their location or income, have timely access to EMS. This is just not a matter of convenience, it's a matter of life and death. Enhanced funding will allow EMS providers to invest in better equipment, training, personnel, thus improving patient outcomes. The City of Madison Heights intends to use the additional revenue stream to increase staffing, offset capital improvements for EMS, and invest in training, enhancing EMS care elsewhere within the City of Madison Heights. 3, economic benefit to the state. Implementing the GEMT program can have a positive economic ripple effects throughout Michigan. The additional federal funds brought in by the program will help the financial burden on local governments and taxpayers, allowing those funds to be allocated to other critical areas such as education, infrastructure, and public safety. Moreover, by bolstering the financial health of the EMS agencies, this program can help the numerous departments struggling to maintain adequate staffing levels at this time. Leverage federal fundings. The GEMT program is a federally supported, meaning that Michigan can leverage federal dollars to enhance the state's healthcare system without imposing additional financial burdens on the state's budget. By drawing down these federal funds, we can increase the financial resources available for EMS providers, making it financially responsible strategy to improve the public health structure in Michigan. 5, alignment with Michigan Health's goals. Michigan has always been a leader in healthcare innovation and commitment to public health. Implementing the GEMT program aligns the state's broader goals to improving healthcare access, equality, equity, and outcomes of all residents. It demonstrates the commitment to supporting their essential healthcare workers, ensuring every citizen has access to EMS, irrespective of their financial situation. In closing, the implementation of the GEMT program is just one crucial step towards securing the future of EMS in Michigan. It offers a practical, financially sound, and ethically responsible way to support EMS providers, provide access to care, and enhance the overall health and well-being of our communities. I urge you to consider the profound benefits of this program, take action to implement the GEMT program in Michigan. This can bring in additional funds to cities like the City of Madison Heights or the 22 other communities that the Oakway Mutual Aid Association departments serve. You can assure that EMS providers throughout Michigan have the resources they need to save lives, that every resident has access to emergency care they deserve. Thank you.
Thank you. Please go ahead.
Thank you. My name is Derek Hillman. I'm the Deputy Commissioner with Detroit Fire Department. First off, I want to say thank you. Thank you for taking this bill up. It means the world to the Detroit Fire Department. First off, I want to talk about practical reasons for it. The Detroit Fire Department responds to 200,000 medical emergencies a year. 74,000 of those are Medicaid billed for situations. Having said that, that's approximately 40% of our call volume are Medicaid. This revenue that we're missing out on the Detroit Fire Department could bring in about $15 to $20 million. That's a huge, substantial lift that the city is taking on right now that we're missing out on. And having said that, we train our citizens that we hire from having no certifications all the way up to paramedic level now. If we don't have these funds, just like everybody else in the state, we're struggling with first responders. We need to create our first responders. By doing this bill gives us an avenue to start creating that training pathway. We can take this money, fund our paramedic program, all the way from our basic EMT program. We trained over 700 basic EMTs last 2 years in the Detroit Fire Department. This year, we're starting our first paramedic program, and this is a pathway of sustainability for the Detroit Fire Department and a pathway for the state. We need you guys to make sure that you understand the implications of this bill. It is a substantial help to the department, a substantial help to the cities, townships, and residents. So I want to make sure that everybody here understands the impact that it will have. This is a positive bill. I'm excited that everybody here has a say in this and will have a positive support for it. And I appreciate your time.
Thank you all for your testimony. While we have people gearing up for questions, I just want to say again, thank you for your time, your testimony, and for your service. Obviously, you're joined here by a number of colleagues in uniform from departments that you represent and otherwise, and so we thank you very much for your service to our communities back home and for your attention to issues like this that do impact the lives of local residents in each of our communities. And so with that, I'm going to have a couple of questions from members here. First, though, Representative Preston.
Thank you, Chair. So Dave Preston, I'm a paramedic as well as a volunteer firefighter. This bill was brought before me, and I did a little bit of a deep dive in it. It does really well for the high volume municipally based agencies, but up in the UP, northern Michigan, we have a lot of volunteer based agencies, and this actually could be a net negative on their books. They don't have the call volume up there. There is not enough for them to fully take advantage of the costs that are associated with the implementation of this program. So whereas it definitely helps the high volume departments, it further devastates departments that are struggling to hold on. Right now, on the far eastern end in Kinross, we've got an EMS service, a 3-truck ALS service that services Chippewa and Kinross Correctional. They're 2 payrolls away from going under. So I understand the desire to go after these funds, but they do not treat all of the EMS agencies fair or equal. If you have high call volume and you're a highly organized department, you'll do great with this program. If you're not, if you're the service like that I serve on still, Mid-County Rescue Squad, which is a volunteer-based agency that's a BLS service only, this offers us nothing, as well as across the UP. I don't even know that Marquette's going to have the call volume to really see a benefit out of this. It might be a push. So could somebody maybe speak to that as to, where is DHS, the EMS division on DHS on that as far as a stakeholder? Where does Moss sit on this? Where's everybody at on this?
If I could address that, because I have personal experience with the GMET program from a different state. Your department, as you go through the cost report, you can hire someone to do that, and then that amount of money that you spent to hire someone to do that financial network can go into the following year's cost report to be reimbursable. Yes, you might not have in your agency the $900,000 that I might see, but what you might see is $50,000 a year. That would be enough to help you purchase, a cot, a Lucas device, something like that. So I think this program benefits both small agencies and large agencies because really the amount of money, so say it's $600 that you get for this BLS transport that you're providing to the Medicaid patient, and the federal government's only going to give you $200. So you have that uncompensated cost of $400. You're going to get 63 cents back on the dollar of that $400 to be able to put in to your services at a future. It could be additional training classes that your service could hold. It could be, like I said, the Lucas device that will help you on these calls. It may not be the high prices, but it will help your agencies.
That's really not my point, though. My point is that we don't have the transfer volume to actually take advantage of this program. This program has a threshold, and back when it was first introduced, I did not think that we were going to be bringing this one up, so I didn't prepare as much as I should have. But I do remember that there was a break-even point that was far above and beyond what most of my agencies are seeing as far as call volumes on their transfer and transports. So, like Mid-County Rescue Squad, we're talking about a 3,500 run per year squad. Ken Ross, vast majority of it is corrections. It really just depends on the service itself, and this is again a one-size-fits-all across the state, and it will adversely impact the volunteer agencies in the north.
If I might be able to add or ask the question, then I think there's two conversations going on here, right? The bill is requiring that we apply to the United States Department of Health and Human Services for this program. However, we are not the ones administering the various requirements for the program. That we are just beholden to those at the federal level. Am I correct there?
Yes, you are. But some of the program, and this is across the country, there's a cost report that you fill out, and then you put all your costs to and run your agency. That has to do with vehicles, what you've put in for leases for those vehicles, for EMS vehicles, not fire engines, but just EMS vehicles, the space that those vehicles take up in a facility, heating and cooling. Those all go into a federal spreadsheet to figure out what it costs for you to provide that. And then what you do is you match that against the Medicaid payments that you receive, and then that's the uncompensated cost that you're eligible for. I hope that explained it a little bit better.
No, that provided some additional background there. Thank you. I have another question from Representative Pies.
Thank you. To follow up on, Representative Preston's concern, I understood this to be an opt-in thing, so it's not that it must happen. It's an opt-in, correct?
You are correct. That's
Okay.
completely voluntary. If an agency does not want to participate, they have to just do nothing. They operate as normally as they would.
Okay. I'm thinking then you're probably getting pushback also from city managers and on something like this? No, you're not. Okay. I thought they were.
No, city managers and Michigan Municipal League is behind this.
Yeah, if I could go back to, and also Representative Preston's, so Moss is neutral. We've been working with DHHS. They're the ones that provided the additional language. They are coming in at neutral initially, but they are reviewing because we added townships to one of the words, and so they wanted to review it again. I'm not really sure that will change anything because we wanted to make sure townships were included. But the Michigan Municipal League is one of the supporters. So is the Township Association, the County Association. So and obviously the fire chiefs. So no, the Michigan Municipal League is in support, and there's no pushback from city managers.
Okay. So if the service is being outsourced right now, this could be used as a sort of argument, if you will, then on why to bring the service back through city supplied. Do I understand that correctly? That could save the city money then.
I'm not really sure that most municipalities are in a position to do something like that. I mean, the trucks are not very cheap, as you know. I know you sat on local government, so I do not foresee that. You might be able to speak to that as to what happened in Illinois.
What I would share with that is EMS is a local community's ability to manage it however they want to, whether they want to do a third service EMS, whether they want to do a municipal fire-based EMS, or whether they want to, consult with a private to do that. This program is just a federal program that is eligible for public agencies. One of the things that has been real key with this, and I've had a lot of conversations with MOS members, because some MOS members will actually benefit from this program that are county agencies that run EMS. And it really hasn't detracted any of the services in Illinois and didn't really change the landscape at all. Private still did the private work and covered some of the municipalities, and then regular fire-based or third service EMS covered it. It really didn't change the landscape. It just brought additional federal dollars into the state when EMS is struggling right now.
Representative Rogers.
Thank you, Chair. My question, so thank you for outlining and thank you for the clarification of the opt-in. I think that's very important. I'm generally supportive of this legislation, but can you talk a little bit more or give us any kind of high level about the costs? And I think there was the question about, small versus large sizes communities. Can someone touch on that and how this is flexible enough maybe or not to deal with those kinds of situations? Thank you.
Because this is voluntary, if you're a small agency, you could run the cost report yourself and then go, is it going to be beneficial for me to put this extra work in or not? What I can tell you as a fire chief in Illinois, when this first came out, I was very busy. Usually there's an enrollment period when you set this program up of once a year, that if you didn't do it the first year, you could get into the second year. So when this was stood up in Illinois, I didn't do it the first year. I had a municipal service that ran about 3,600 calls, and we opted in when the next issue came up that we could get into it. It's been very beneficial for their community. I estimated it brought in about $250,000 at the time. I'm still in communications with that fire chief, and it's bringing in about $270,000 now for them. So again, I can help, or even anybody can help with those cost reports to figure out whether it's beneficial for that agency to be involved in it.
Thank you. That background's helpful. Appreciate it.
Yeah, and looking through the H2 that we just adopted, we see a lot of language about eligible providers, eligible, that clearly this is, making that opportunity available. And I think this has been a committee that has continued to really highlight that where and when we are able to give tools to our local providers, that we want to be able to make that accessible. And so I do think that this H2 substitute has been well thought out by those who have provided that and who have continued to work through stakeholder feedback. Representative Bazat.
Thank you, Mr. Chair. Thank you guys for coming. Coming from the public safety, also working as a county commissioner, I know, is this money, I got a couple of questions if I could, Mr. Chair. Is this money earmarked for your departments, guaranteed to go to your department?
Not necessarily. It would go back to the governing agency, but most agencies are willing to put it back into it because where it came from.
That's what worries me right there, because I'm recruitment, retention, equipment, all those things coming from law enforcement. We all need those things, especially nowadays when it's hard to recruit anybody for your departments, law enforcement, EMS. So you got it coming in the front door, and you got politicians taking it out the back door and shorting your budget, correct?
It could be a possibility.
Yeah. Okay, that's a concern. I don't know if we can fix that or not, but the money should be earmarked for the department over and above your general funding that you're getting right now. That's just my thoughts. Thank you, Mr. Chair.
Yeah, and I think that local communities will make that determination. I think that also, I think anyone sitting at this dais is going to be able to understand too, back home, our firefighters are our pride and joy, right? We are very proud of the departments that we have, and that I think that if anyone felt like their department was lacking, especially with the potential influx of funds that come from this program, that there would be quite the stir in any community to be asking and to have your backs to ensure that you do have the recruitment, the retention, the equipment to make sure that our communities are safe. Not saying that that is perfect in every scenario, Representative, but your point is well taken, but I do believe that the good faith efforts made by our city managers and elsewhere do help to support our departments first and foremost. So thank you. Representative Hill.
Thank you. I do represent Marquette and the Central Upper Peninsula, and where they are very curious. They had not applied for this because we weren't eligible, but I sat on the city commission. We are very interested in this program because it might be that extra funding that could really help us with equipment needs. Equipment wears out faster in our region, and so we are very interested in making. I've been in conversation with the city manager and city commission. I also want to pull out. I have 3 prisons in my district. And this is a little bit of an aside, and Rep. McFall and I have talked about this, but we have a different issue with prison ambulance services where a contractor has gone bankrupt and was paid by the state. It was a And so we are having, this is actually maybe more a plea for help. I'm just taking, while I'm here on the floor, our prison ambulance services contracted with a company called WellPath. That company has gone bankrupt. They were paid by the state, and they are now not being compensated for millions of dollars. And so that is another issue that we're attempting to support with our emergency management, emergency services, unfortunately. So I think it goes to show how critical this is and how we want to make sure there's really clear communication. It sounds like in clear lines and chains of accountability for this money. And I appreciate your working so hard with so many to bring this forward.
I appreciate you bringing that up because that is a completely separate issue, but this money will not flow through a separate organization like the one that went out of business. But yes, I do agree that we need to do something about that. So thank you for mentioning that.
Thank you, Representative. Representative Preston.
Thank you. So I sit on the EMSCC committee. We talked about that. It went round and round. There was not a motion to support. There are still a lot of unknowns. I'm assuming you guys know the scope of EMSCC. It's all things EMS. This is going to support and probably help 70% of the agencies out there. But for all the non-government-based agencies, which the UP is littered with, this is going to be a drag on us. And I just, without broad stakeholder input and support, especially within the ranks, EMSCC, MAS, everybody else, I mean, to go ahead with this with neutral or undetermined, I just think it's premature, and I think that this is rushed. There's too much to not know about this program, and I've heard about this program may not even continue on the federal level. So I would just say, remember all of us out there that are fighting to just keep our doors open and to keep our wheels turning. So
I appreciate that as well. Unfortunately, I mean, the rules are set up by the federal government as to who can actually benefit from the program. So the beef with that is more with the federal level. Because, I mean, I could add you in there or I could add them in there, but it wouldn't do any good because they couldn't qualify for it.
But the costs are borne out across all the agencies. Everybody pays into this.
Right.
But not everybody gets something back from it.
But what I don't think, though, that we should inflict any more harm on our local municipalities. I mean, when we have some money that we can bring in, our tax dollars, back to our state that we're leaving on the table, I don't think we should penalize our local municipalities because of that. Like, I feel like if there's a program at the federal level that we can qualify for, that we can bring money back here to our local municipalities, I think we should apply for that stuff every single time.
So contact your Congress member. Okay. Representative Begole.
Thank you, Mr. Chair. I just want to comment that I didn't receive this until almost the close of the day yesterday. And although it sounds like it could be beneficial to some of the bigger departments, my colleague has raised some concerns and some questions that I wish we'd get some answers, solid answers to, because it sounds like there's some possibility that his ambulance companies up in the UP may be detrimental to them. So I don't know if we're planning on voting this, but I think we need a little bit more time to investigate that to make sure who it's going to benefit and who it's not, or if it's going to be harmful to some of the agencies. I appreciate your hard work on it. It sounds like, that this is of great value to some departments, but I hate to vote on something that we don't have all the information on.
I have a question here from the chair. My question here is really I want to clarify, because this is a federal program, for a smaller municipality or a smaller provider, there is not necessarily a detriment to us applying for this and bringing back these funds. That there would have to be that cost-benefit analysis to determine whether or not participating in the program would actually make an impact for their department. However, there would not be a drag or a detriment, some other terms that I've heard used, by having this available to other departments. Am I correct in hearing that? I'm welcome to take the answer from anyone.
No, there's no drag down. There's no punishment for not participating in the program. There's not taking away any fundings from any other agencies out there. This is federally drawn funds to publicly owned EMS agencies.
Not seeing any other questions for the four of you. Thank you so much for your testimony. We do have some cards to read in and one other person wishing to testify. We have Angela Madden from the Michigan Association of Ambulance Services wishing to testify. Did not mark support, oppose, or neutral, but you're welcome to come forward and provide your testimony. And we're waiting in suspense for your position.
Good afternoon, Mr. Chairman, members of the committee. I'm sorry, my written statement may hold you in suspense just slightly longer, I'm afraid. My name is Angela Madden, and as already noted, I'm the Executive Director of the Michigan Association of Ambulance Services, or MAWS. MAWS represents agencies of all sizes, shapes, and ownership types, and we cover 80% of Michigan's geographic territory. The agencies included in our membership are municipal. They're third service, they're municipal authorities. They are hospital-owned, like our partners in Marquette. They are volunteer, they are nonprofit, and they are private EMS agencies. And I really want to take this moment to thank you for looking for a way to support EMS in Michigan. I'm here to talk about 5695, which would create a GEMT program here. And while we appreciate the efforts to improve payments to cover the cost of providing EMS, this approach, as has already been said, will only help a small subset of EMS agencies in our state. It means the effort to bring in extra money to help EMS, and I'm going to use some different terms here. I'm going to talk about it not just in helping agencies or municipalities. I'm going to talk about it in terms of helping our patients. Based on the total number of patient transports, this program would help 1/3 of patients transported in the state of Michigan. 2/3 of the patients transported in the state of Michigan would not see the benefit of these additional funds. To further the inequality in some areas, municipal agencies utilize mutual aid with private companies. The calls handled by those private EMS agencies in a mutual aid situation where a municipal agency typically would answer that call would not be eligible for these funds. I also want to take a moment to talk about the federal component of this program. Similar programs have been instituted in other states. However, currently, due to issues related to expense reporting, in some of those programs, the CMS has paused approving new state plan amendments with these programs included as they continue to investigate those issues, particularly in the states of California and Texas. The best way to support EMS in Michigan is to initiate programs that help all patients. This is even more critical as we already have a couple of very serious issues that are making it more difficult for agencies to serve their communities. EMS agencies, whether private or publicly owned, are experiencing the same challenges, including staffing shortage, skyrocketing costs for vehicles and supplies, and an increase in demand for services. At the same time as we're looking at this option, the Michigan legislature failed to keep up with the increase in compensation in Medicaid to Medicaid beneficiaries that Medicare instituted in January of 2024 and froze Medicaid reimbursement payments at the 2023 rates. As a state, we're failing multiple agencies by not compensating them for the treatment of patients in MDOC facilities, which has been at length discussed today, which has part of the UP in danger of losing their coverage. And to close, I do want to make one final one adjustment to something that Chief said earlier about the percentage of public payers for EMS agency. I know he quoted a 50% number. That number is actually 76% in the state of Michigan. 76% of EMS compensation is from Medicaid and Medicare statewide. So thank you for this time to be here in front of you, and I appreciate your time, and I'm happy to answer questions, which I'm sure you'll have for me.
We do. Ms. Madden, I have a question from Representative Hill.
Okay, so that was a lot, and
Yeah.
Thank you. Okay, so I think what I heard you say is private providers will not have access to these funds.
Correct.
Okay, so that's one question. But other providers would have access to these funds.
Correct.
And but if we had increased reimbursement rates to Medicaid, both sets would have benefited from that.
Correct.
And the decision about increasing Medicaid happens at DHH&S, not in legislative. Is that correct?
It happens through the state budget, ma'am.
Okay. So, and that door opens once a year.
Yes, ma'am.
And it's froze at 2023. Are we not in the 23-24 fiscal year? So I'm confused.
CMS updates their rates January of every year. So the budget that was just took effect October 1 does not reflect January 1, 2024 CMS increases.
Okay. So we're a year behind.
Correct.
Okay.
And with it looking, so it was just released, January 1, 2025 was just released. We will be 2 years behind effective January 1.
Okay, that's helpful. And different communities have different ways of paying for things. And as everyone on this in this room probably knows, I am, if nothing, a champion for more money coming back to our local governments. And there were other bills that we could have done, such as the Local Revenue Trust Fund, which would have guaranteed funding going to local governments, throwing that in there. So I'm grateful to have this issue raised to our attention about the reimbursement rates for Medicaid and Medicare. I certainly hear about that from a number of different contexts. I do know that that's a very important issue. The question in front of us right now, though, is how do we get funding for, this is money that's coming down from the government that would support certain agencies and maybe free up money for us to do other things. So I don't quite understand if there is money available that would there then be more of any available for other things to happen because you've covered, that's.
Forgive me, Representative. I just want to clarify one thing you just said. The way I understood your recent comment is if we draw down federal funds to supplement Medicaid, this legislature could then reduce Medicaid funding to free up money for other things.
I'm saying that you have more money, if these departments have more money available that they don't have access to right now because we need to make a change, would that not allow there to be more money? You know, we could, that, thank you, sorry. They now have, whatever that number was, $9 million, hundreds of thousands of dollars that these municipalities would have. Then could we not move money to support the communities that don't have access to this service?
I'm not sure how that would be accomplished. I don't foresee, EMS agencies run at such a slim margin right now, regardless of their ownership type. I don't see anybody giving up money and moving it to shifting it to potential their private partners within their community, if that's what you're suggesting.
I'm talking about the state having more, but it does seem, I don't quite understand. If there is money available, why are we leaving it on the table? I would like a clear answer to that, please.
As of right now, CMS has paused the approval of all these programs, so there is no money on the table immediately.
But that doesn't get at asking, so why not ask so that when it is available, we could go get it?
My response to that is because it doesn't benefit all patients, and there are other ways that we could benefit all patients in our state.
So I think that that's a great place to kind of leave that, because I think that, and Ms. Madden, thank you. We have no other questions for you, so thank you very much for your testimony today. I think that this is really an opportunity to say, while we cannot impact 100% of patients, we have an opportunity to impact a lot of patients and a lot of municipalities. And as I've said, this committee has continued to look for opportunities to support our local municipalities with whatever opportunities and tools are available to us. And I believe that this is one of those opportunities. With that, I do need a motion to bring, I do have some cards to read in. I have a few cards to read in. Samantha Gibson with the Michigan Association of Counties, not wishing to speak in support of the bill. Not wishing to speak in support of the bill, Harrisana Richards from the Michigan Municipal League. Not wishing to speak in support of the bill, Chief Ryan Allen, Orion Township Fire Department. Not wishing to speak in support of the bill, Ryan Monroe, City of Roseville. Not wishing to speak in support of the bill, Chief Dave Piche, Independence Township Fire Department. Not wishing to speak in support of the bill, but did provide written testimony that we will add to the committee record. Matthew Covey, Fire Chief of South Springfield Township. Craig Puckett, not wishing to speak in support of the bill with the Conference of Western Wayne. Not wishing to speak in support of the bill, Joshua Mosher from Northern Michigan Association of Fire Chiefs. Not wishing to speak in support of the bill, Johnny Menifee, President of the Michigan Association of Fire Chiefs. Not wishing to speak in support of the bill, Teresa Robinson, Fire Chief of the City of Ferndale. Not wishing to speak in support of the bill, Judy Allen, Michigan Townships Association. Not wishing to speak in support of the bill, Amanda, I believe. Amanda Bright Clanahan, City of Dearborn. Henry Yalvez, City of Sterling Heights. And Daryl Stomper, City of Westland Fire Department. I also have a stack of cards here that I will not, they're all not wishing to speak in support of the bill from individual persons, but I just want to, and we will have all of these scanned into the committee record, but I just want to highlight some of the areas that are represented in this stack. Sterling Heights, Battle Creek, Sault Ste. Marie, City of Ferndale, Romulus, Houghton Lake, Lake Leelanau, Waterford, Lansing, Leonard, and others. So I just wanted to highlight a few of those municipalities and areas that are represented in that stack that we will have scanned and submitted for the committee record. With that, I will take a motion to actually report House Bill 5695 as substitute H2 with recommendation. That motion is made by Representative Burns. Madam Clerk, would you please take the roll?
On the motion to report, Chair Fitzgerald.
Yes.
Representatives Burns.
Yes.
Shannon.
Yes.
Breen.
Aye.
Rogers.
Aye.
Hill.
Yes.
Hoskins.
Yes.
Pies.
Yes.
Zorn.
Yes.
Paquette.
Pass.
Bazat.
Pass.
Begol.
Pass.
Preston.
Pass.
Mr. Chair, you have 9 yeas, 0 nay, 4 pass. House Bill 5695 is reported with recommendation as H2.
Great. Thank you very much, everyone, for your time and attention here today. With no further business before the committee, this committee will stand adjourned.